Okay, so in scaling a program, let's talk about growing pains. And actually, you guys have all been a part of it, so feel free to contribute. But from a facility plant standpoint, what are some of the things that you've gone through?
We can talk about central processing, which is sort of the heart of what we do. It's very crucial that you've got a team in there that knows what they're doing and that can process instruments. So in a surgery center environment, before we implemented the joint program, day-to-day operations were relatively easy. Well, the trays get bigger and heavier and they just keep coming. And so, for example, we're doing a lot of total shoulders right now with a surgeon who probably has us run about 6 trays per procedure per shoulder, depending on if it's a reverse or not. Processing our sterilizers right now are not truly big enough or efficient enough. So we've added members to that department in staggered shifts so that we have a much later shift so that we can receive trays later in the evening and run them later in the evening so that they're ready for the morning's cases. And so now what we're also looking at is replacing our 2 sterilizers with much larger, more efficient sterilizing capacity where we could now actually sterilize in one of the 2 sterilizers that we'll be getting between 9 and 11 trays. So at any given time, we would be able to do 22 trays within about an hour.
Wow.
So that'll give us capacity to run tandem rooms for Dr. Wong, who's ready to go. But unfortunately, it's not just plug and play. We'd really like to just be able to get the sterilizers, plug them in, and go, but there's a little bit more involvement in that.
Is that renovations?
It's renovations. They require a reverse osmosis system. You know, it's a lot of involvement with an architecture and design, and then the backup of the trays. You know, we really want to grow into more space. So that we can accommodate all of the trays that come in the morning and in the afternoon.
There's a lot of things that happen outside of just what's going on in the OR that has to flow well, you know, from your pre-op to workflow to PACU, discharge out of PACU.
Is that your job, Dr. Peters, to make sure that flows through the day?
And the surgeon complains enough.
No, I hear about it and then I
director.
usually find out. But I think the other thing I would add is you really need strong leaders in the trenches every day. So to check on those trays, make sure everything's ready for the next day. You can't be in a situation where, oh, well, that's not my job, you know, that's someone else's job. But I think it's everybody's job, and you kind of have to look out, you know, people have to feel like, okay, well, maybe I forgot to check on this, but someone else will check for me. You know, the other thing that's very important that I found is it used to be, you know, everybody had to wait for the tech to be ready and everything set and draped before you could bring the patient in. So we had to get the teams comfortable with dual processing at the same time. In other words, the tech can set up while the anesthesiologist does the spinal. You know, you don't have to have everything ready. I think things just have to. For that to work, though, I think everybody has to be on the same page, and that's the nice thing about a surgery center. Once again, is because I think you have the same teams doing it all the time. They know each other. You know, we're on the same page.
Got each other's back.
You have each other's back, and I think that makes it work.
Good. Any other facility issues that you can think of that you were major? Or I mean, central processing is a big one. That's a really big one.
Yeah,
Pain points along the process of, you know, the whole flow.
I think that's the biggest one. I mean, we, you know, staffing, we've had to add some staff, so we like to have at least a second scrub in there if we don't have a physician assistant helping our surgeons. So these are some of the more complicated things that we're just going to have to get in front of in order to continue to work on the program. To turn over as many joints as we would like to do in a day or a week.
You know, at any point, if there's a bottleneck in any point of those phases, then you're backing up your turnover time in the operating room. So the patients aren't getting discharged out of the PACU fast enough, that backs you up. if there isn't a bed in the pre-op unit and a nurse available to get that patient going and ready in time, then that backs you up. So everything has to flow smoothly for you to be able to even start thinking about scaling and doing things faster.
So any one of those are pain points.
Absolutely. Any bottleneck that you're going to have along that process is going to back you up.